Hi, this is Dr. Gary Sykes, and this vlog is on the topic of epidurals and normal vaginal deliveries. Some women are anxious, they're worried about having an epidural because they've had stories. If I have an epidural, I won't be able to push my baby out. Well, that's not true. That is definitely not true. You have to be managed very differently in second stage because you have lost that sensation. Without an epidural, when a woman's in second stage, the baby's head's coming down, she has this uncontrollable desire just to bear down and to push. But that goes once the epidural is in place. So if the mistake is made to get her pushing too soon, in other words, although she's fully dilated, the head is relatively high in regards to the pelvic outlet, then she's going to not push well because she won't have the sensation, be hard to get direction. She's going to exhaust it more easily, and certainly that would increase the likelihood of having an operative vaginal delivery. But if you manage that woman very differently, in other words, as long as the baby's well, you allow there to be passive descent of the baby down the birth canal, and you only get it pushing when the baby's head is basically at the level of the vaginal introitus. It's way down low. That means it won't take a lot of effort for her to push the baby out, and that will optimize her chances of having a normal vaginal delivery. What that means is you can have a passive second stage and go on for 1 or even 2 hours. As long as the baby is well, there's no problems at all. But I certainly wouldn't like a woman actually pushing for over an hour, certainly 2 hours in second stage. That is not a good idea, but it requires a different management. Sadly, a lot of midwives get patients pushing too soon with an epidural just because they're fully dilated, and I'm forever telling midwives to stop and allow there to be passive descent, because my goal is for you to have a normal vaginal delivery and an intact perineum. And certainly I'm more than happy to have an epidural. I mean, I think that it's quite a sensible idea. I'm more than happy to have an epidural if you want, but also I don't want you to have an unnecessary operative vaginal delivery. Hope that information helps. I look forward to speaking again soon. Bye for now.